Hello everyone and welcome to Autism Spectrum Disorder, First Steps After a Diagnosis. I'm very excited to be here this evening with Esther Rhee of Autism Speaks Canada, who will be speaking about this very important topic. This presentation is intended to discuss navigating autism. Navigating autism in terms of a diagnosis can be complex and confusing. Families are often left alone to understand the system all on their own. Tonight we'll discuss resources, information, and tools to help after receiving a diagnosis. Remember that you can save $65, which is our administration fee if you mention that you participated in this webinar. If you book an appointment with Children's Support Solutions between now and May 25th, 2017, you can book an appointment by visiting our website at www.childrensupportsolutions.com or call 1-866-653-2397. If you do have any questions for us this evening, you can pose them by going into the software menu on the side and going into the questions portion and typing in your question, and we'll be happy to answer it at the end. Morneau Chappelle helps over 500,000 people each year through therapy, education, and coaching. We help children reach their potential through an interdisciplinary and family-centered approach. We offer assessments and treatment in psychology, speech-language pathology, behavior therapy, occupational therapy, physiotherapy, and special education, with 3 locations in Ontario and 6 locations in Quebec, as well as 1 in British Columbia. We also offer services online. Our presenter today is Esther Rhee, who has a Master's of Social Work. She is the National Program Director with Autism Speaks Canada. She oversees the organization's mandate to increase research, family services, awareness, and collaborative initiatives in Canada. Autism Speaks is a global science team with specialization in community capacity building, program development, and navigation support strategies. Esther is also a clinical therapist for children exposed to trauma and general mental health for all ages. So welcome, Esther. We're excited to have you.
That's great. Thank you so much for that introduction. And I want to thank everyone on the call for spending their evening with us tonight. I'm really excited to talk about navigation support strategies. This is an area that's really of interest for me and something I've been working on for about the last 8 years across Canada. So in terms of the outline for tonight, what we're going to talk about in the time that we have together is I'm going to give a brief overview of who Autism Speaks Canada is and what do we do as an organization, so you can have some background on that. I'm also going to go into what is autism spectrum disorder. I understand that many of you on the call are joining us because you've either recently received a diagnosis or you may be thinking about getting an assessment and wondering if you're seeing red flags around autism spectrum disorder and what some of that may look like. So we'll really focus in on some of those areas, and then we'll move right into navigating an autism diagnosis, and hopefully I'll be able to provide you with some tools and resources that will be helpful for yourself and your family in finding the best supports in your community. So we'll start off by giving an overview with the organization. Autism Speaks Canada is a national organization. We focus on 4 key areas in the autism community, and those 4 areas are research. We originally started as a research organization. We also focus on collaboration and working with the autism community. It can be a very siloed and fragmented community, and so we work on bringing that together. We focus on increasing family services and also building awareness. And so on the next slide, we'll see we did branch off from our U.S. affiliates, and together we're considered to be the world's leading autism organization, both in research and advocacy. And what we focus on is enhancing lives today for families and service providers, and then also accelerating a spectrum of solutions for tomorrow. And the majority of that is done through our research arm so that we can better understand how to support families. To give you a little bit of context, we are also a funding organization. So we've been able to fund over $200 million to support autism research. And in Canada, everything we raise in Canada stays in Canada. So we've been able to support $9 million in research across our country. And then in terms of our family services, which is anything that relates to information, services, and programs for families today, we've been able to fund over $4 million to over 200 organizations in Canada to make sure that they're best equipped to support the families that they're serving in their communities. And so, as I mentioned, our commitment is to support the enhancement of research and services across our country, and also to raise awareness, to encourage inclusion and collaborate alongside the autism community as well. What I'm going to do now is actually go through each of these pillars very quickly and just give you a snapshot about some of the things that we're working on so that you can have a better understanding of what it is that we do as an organization. I'll start with our research arm, and here I've listed 4 examples of some of the things that we're working on. In terms of our research, we've been able to fund over 600 research grants, and that's internationally. But in Canada, I'd like to highlight 4 key ones. So the first one is the Baby Siblings Research Consortium, and that's a global consortium of researchers who are working on identifying the earliest detection of autism, and how we're doing that is taking a look at babies that are considered to be quote-unquote high risk because they have a sibling that already has a diagnosis of autism, and because we know that there can be a genetic link to it, we take the baby siblings and we take a look at observing their development and figuring out how we can be noticing autism very, very early. And so right now we have indicators that help us identify some features of autism as early as 8 months. The next one is in terms of the research chair that we support here in Canada. So Dr. Jonathan Weiss is the research chair in autism treatment and care, and he's primarily focused on mental health and well-being for individuals with autism. And so we've been funding him for the last 4 years to take a look at innovative treatment support that we can be providing for families to support with the mental health aspects of autism. The next one is the Autism Treatment Network, and this is a collaboration of hospitals and institutions across North America. We have 14 sites, and they specialize in providing multidisciplinary medical care for individuals with autism. And what that means is that they're developing standards in evidence-based medical care and treatment guidelines, and there are teams that have come together that include pediatricians and psychologists and psychiatrists, professionals like neurologists and dentists, and also specialists in the areas of gastrointestinal issues, metabolic issues, sleep disorders, epilepsy, anything that would impact the medical side of care for an individual with autism. And they're developing the best guidelines in terms of supporting that individual. And so what they've done is developed a number of toolkits, which I'll get into a little bit later on. But these toolkits take a look at standard guidelines in our practice around things like drawing blood for an individual with autism, dental care, feeding behaviors, or making medication decisions. If individuals have sleep issues or issues with managing constipation, there's toolkits that have now been developed through evidence and research that we've collected through the 7,000 individuals that have come through our ATN site that allow us to develop these guidelines. And so in Canada, we have 2 sites. One is in Toronto, and that's a collaboration between Hospital for Sick Children, Holland Bloorview, which is the Kids Rehabilitation Hospital, and Surrey Place Centre. And then our other site is also in Edmonton, and the lead is the Glen Rose Hospital there as well. And the last research piece that I'll talk about is the missing program that we're supporting right now, which is a partnership with the Hospital for Sick Kids and Google. And this is the initiative to do whole genome sequencing on 10,000 individuals with autism and their families. And the intention of this is so that we can better understand how to develop personalized care for families so that they can get the best treatment right from the beginning. That there's 400 genes identified as being associated with the risk of an individual later on developing an autism diagnosis. In recent studies, we've been able to identify 61 new genes that we didn't know before out of this program. And some of the findings that we're seeing is that some of these genes that we know are related to autism are also related to some other areas that are important for us to consider when we're developing plans of care. So for instance, there's genes that have an overlap with, say, cancer or epilepsy. And so if we know that an individual has that gene, it's important for us to make sure that an oncologist or somebody who specializes in epilepsy are part of that individual's treatment team right from the beginning. And so those are some of the exciting things that we're working on in terms of missing We'll move right along into collaboration, and this is an area that we work with with partners all across Canada and beyond as well. And so we are part of many provincial and national advisory teams, and these are just an example of some of them. CAS is the Canadian ASD Alliance, and that's a group of 200 organizations across Canada that come together to help move the agenda forward. Ready, Willing, and Able and Worktopia that are listed there were two programs funded in the 2014 federal budget announcement to help support employment opportunities for youth and adults with autism. And we're on the leadership team developing these programs across Canada. They're actually the first programs ever in Canadian history, which are very exciting. And beyond this as well, we also work with Public Health Agency of Canada so that we can find Canadian prevalence numbers, because right now we do still use U.S. numbers. And then some of the ones that aren't listed on here are, for instance, the Toronto Police or the RCMP and the military. We have partnerships with them. We have a rural and remote communities network through every province and territory in our country that brings together these communities that are often quite isolated, and also serving Aboriginal and First Nation communities as well. So we really do focus on collaboration, and we feel that that's a responsibility of ours as a national organization to be doing that. The next slide focuses on awareness. And here are some photos from our Lighted Up Blue campaign, which is the biggest awareness campaign. And so on World Autism Awareness Day, which was April 2nd, and throughout the entire month of April, we focused on shining a light on autism as our Lighted Up Blue campaign. And in 2016, 157 countries participated in this global campaign. The next slide also focuses on some of the partners that we've had that helped us bring this awareness. And so you'll see some images of the Toronto Blue Jays. That's actually Toronto Police Chief Mark Saunders and his sons throwing up the first pitch. We have great corporate partners such as Colonels and Toys R Us who help us bring a lot of awareness through the wonderful work that they do. And then we also have our walk events across the country that are not only our fundraising initiative, but they're really meant to be a celebration in our communities and to bring service providers and families together. The last piece here is the Family Services Department, and this is really the area that I want to focus on today, because this is the department that focuses on increasing resources and tools for you to ensure that you are able to make informed and educated decisions about your care path. And so there are some resources here that I'll highlight that may be of interest for you. We have a great partnership with Samsung where we actually are able to give away free tablets to families and service providers across the country. We know that technology can enhance families' experiences significantly, and one of the ways that we want to support that is eliminating the financial challenge of accessing tablets, and so we give those away every year. Cineplex is also one of our great partners where we do sensory-friendly screenings across theaters in Canada, and so we're able to open up theaters for the autism community to come in, and some of the sensory adjustments include dimming the lights, the noise isn't as loud, the sit-in-your-seat policy isn't as strict, and we also allow families to bring in their own food because we respect that there's a lot of dietary restrictions that families want to adhere to. The last one that I'll point out here actually is the video glossary, and this is an advocacy tool that was developed because we were hearing from a lot of families that they were getting pushback when they were going to their primary care physician with some signs of developmental red flags, and they were getting some resistance in terms of getting an assessment, often being told to wait it out a little bit, perhaps they'll grow out of it, or being told that that's quite normal in terms of development. And so what we did was put together a number of videos that compared an individual, a child actually, who would later went on to get an autism diagnosis compared to one who didn't, and some very small details that we were noticing that were identified as red flags in development, so that families could take these videos, use them as a tool to say, I see this in my child, this is something that was produced by a credible organization, I'd like to move forward with an assessment to see if a diagnosis is appropriate. So what we'll do now is actually talk a little bit about what autism spectrum disorder is. I know a lot of you on this call may already be familiar with this, but so that we're on the same page with some of the things that we're talking about and some of the findings that are current for today, I'll just go over very briefly autism spectrum disorder. And so we know that it's commonly still referred to as autism, and that really it's characterized by varying degrees in the areas of communication, social and behavioral challenges, and repetitive and restrictive behaviors. We've also learned that both genetic and environmental influences contribute to a diagnosis for an individual to receive an autism diagnosis, and that it's also a lifespan disorder. And so when we think about children having autism, we know that autism goes up, and that children become youth and adults and also seniors, and that we always need to be thinking about how we support the individual best across their lifespan. The prevalence right now is 1 in 68 children, and that is from the Center for Disease Control and Prevention in the U.S. And it is now considered to be the fastest growing and the most commonly diagnosed neurodevelopmental disorder in Canada. And what we're learning about the mental health aspects of it is that up to 70% of individuals also have a co-occurring mental health disorder. And that can include things like an anxiety disorder, OCD, or depression as well. And what we want to be doing is to be very mindful about how we can enhance the quality of life for individuals, and that we want to bring that number significantly down. We also know that autism can affect the entire body. And so when I say this, outside of the core features of what would make up a diagnosis, we also know that individuals with autism commonly experience other issues, such as gastrointestinal issues, epilepsy, obesity, anxiety I had already mentioned, areas like sleep dysfunction or sensory integration dysfunction, mental health issues or challenges with motor skills, eating and toilet training, and the list goes on and on. And so even though we're talking about some very core features of autism in the diagnosis, we need to be very aware of how autism actually presents in the entire body and treat the person as a whole. A study also came out a couple of years ago from the School of Public Policy at the University of Calgary that examined the cost of caregiver support. And what they found, and this is a Canadian number, was that the cost of support for an individual with autism can be up to $5.5 million higher than for an individual that doesn't have an autism diagnosis. So we've always known that there's been a significant financial aspect to having an autism diagnosis. What we're working on as an organization is how do we reduce those barriers, how do we ensure that programs and support are accessible and that finances are never a reason that families don't get the support that they need. And when we're thinking about support, we're always focusing on individual care plans. We know that no two people with autism are the same. We now actually know that even identical twins that share the same genetic makeup, if both of them have autism, the autism is not the same. And so never can we assume that care path will be the same as well. So we're always taking a look at how to support individuals in their unique situation and what's best for them. The next piece here talks about what a diagnosis is and how it's made up. And so when we're looking at a diagnosis and how that's done in Canada, it is up to medical doctors, so whether that be a GP or a psychiatrist, a developmental pediatrician, psychologists are permitted to give a formal diagnosis. Many of you may have had other professionals such as social workers, occupational therapists, and speech-language pathologists who may be able to provide a professional opinion on what they're observing. But in order for that to be confirmed, it does have to go through one of the previously mentioned professionals for a formal diagnosis to be made. And there is no medical test for autism. There's no blood test that can happen to detect if there's autism. It is a series of observations that happen. A variety of screening tools have been developed for this, and a lot of input is put in to having a diagnosis made for an individual. Again, I note here the critical need for individual care plans, and what we're finding is that for many families, through research, navigation support has been the most important service, yet the hardest to find. And that's why we're talking about today, about some starting points that will hopefully be helpful for you and your family. The next slide just quickly talks about more of the formal elements of the diagnosis. So the DSM-5 is considered the diagnostic manual for diagnosis to be made. In May 2003, there were some changes that were made, but really it still comes down to some very key components where we're observing some areas around social communication and interaction, and we're also observing some challenges in the individual around restricted and repetitive patterns of behavior, interests, or activities. And the additional components to the diagnosis are that these symptoms must be present in early childhood, even though you may not see them until later, and that there must be some aspect of these areas that are impairing everyday functioning to some level. Now I want to move into talking about early interventions, and you'll see on this slide that I just lay out a snapshot of some different intervention types that are available. And what I listed here is that we actually have a number of toolkits. Within our 100K toolkit, on pages 28 to 32, we provide a description about each of these different early interventions. And the reason why I don't go into one over the other is because this really is about finding the right fit. And what I never want to do is to assume that your child or the individual in your family would be locked into just one type. And oftentimes you'll be able to find professionals who actually do a mixture of different behavioral interventions. And for those of you who are new to the term behavioral intervention or behavioral therapy, really what we're taking a look at is having individuals the use of reinforcements to encourage certain types of behaviors. And all of these types of interventions do them in different ways. But the overarching premise of behavioral therapy is to encourage the behaviors that we want to see by using reinforcement and motivation. What I will highlight here is that you'll see ABA, so that's Applied Behavior Analysis, and Intensive Behavioral Intervention, IBI. You'll typically hear more about these, mostly because they are the ones funded by the government for families to be able to access. And the reason for that really comes down to there's been a lot of research done on these two areas that would suggest that the evidence is there for them to be applied for families. So what I will highlight is that if you're going to take a look at other early interventions, they just may not be funded by the government. So you may have to pay out of pocket. And in reality, if you're going to be pursuing ABA and IBI, they also may not be accessible, because I know that waiting lists can be quite frustrating and challenging depending on your community, and oftentimes we're finding families have to pay out of pocket for that as well. But those are some examples of early interventions. I do encourage you to take a look at our toolkit so that you can find out more about what these are and what may be best suited for your family. Now, I do recognize that it's very difficult to give an overview of supports and resources when doing a national webinar. And so for the sake of this presentation, I did focus primarily on Ontario, only because it's our understanding that's where most of the callers are actually calling in from. And so what I do want to encourage is, if you are not living in Ontario, or if you have any questions outside of what I've covered today that's specific for your situation, please do connect with me, and I'd be happy to support you or connect you with people in your community who can give you more resources. But in any of your provinces or territories, you'll be able to you should be able to access a list of funding support that's available for families based on having a family member with an autism diagnosis. And so in Ontario, this is a list that talks about funding that you may be eligible to gain support from. A lot of these, I will say, do have restrictions around household income, and I know that that can be quite frustrating, and some of them don't. And some of them are also retroactive, and so if you're finding about it now and you're thinking, my goodness, how did I not know about this for the last 2 years? Some of them, not all, are retroactive back to the date of your diagnosis. So that's a really important question to ask when you're talking to any of your service providers that oversee the distribution of this funding. But I did want to provide this list because oftentimes families know about some of them and not all of them. So I won't go over them to all. Really important step in terms of navigating an autism diagnosis is figuring out who is going to be on your support team. Some common or an occupational therapist and a behavior therapist. Many families are actually connected to those professionals even before receiving a diagnosis, and sometimes they were the ones that prompted an assessment. Social workers are often very critical to have on your team, as well as the medical professionals, and you always want to be able to have somebody to turn to provide educational support as well, so that you know what your rights are or for your child in the school system. Peer and parent support is critical. We know that peer support can provide the type of support that professionals cannot provide. So finding that network within your community of other parents or other people that may have gone through a similar journey is really important, along with your intervention team, and also counseling support, not only for the individual who's received a diagnosis, but for caregivers as well, and also for siblings, and sometimes that includes grandparents and extended care providers as well. So putting together a chart like this that talks about who you're looking to have on your team is really helpful in understanding where to go and who you can turn to. The next two slides talk about the toolkits that I referenced a little bit earlier. So we've developed over 40 toolkits that really talk about information and resources that you can apply for your individual situation. So they range greatly, and I really encourage you to go onto our website at autismspeaks.ca to take a look at what different types of toolkits and information may be useful for you. One of the things I will highlight is that the toolkits are developed out of our U.S. office. So while the information will be quite relevant, even though we live in Canada, a lot of the resources will be specific to the U.S. So please reach out to our Canadian office if you're looking for specific resources. But you can see that there's a vast variety of different topics that we covered across the lifespan, and half of these, as I mentioned, are from our Autism Treatment Network. So again, that's the medical standards of providing care, and the other half of these are developed through our family services to support families in getting the best information to make educated decisions. And the next slide just has more examples. So they range from hair cutting or vision exams or gaining employment or talking to other parents, toilet training. There's so many different areas, so I really do encourage you to use those as a resource. The next slide has some visuals, and I'm going to talk specifically about the 100-day toolkit. And this provides a roadmap for 100 days after receiving a diagnosis. Now, again, families find this useful much beyond that, years after receiving a diagnosis, but this is what we hand out for families when they first received a diagnosis. And there's some really useful resources that are attached that help you track what service providers you've contacted. They also help you take a look at comparing treatments. So we talked about the different types of early intervention. If you've tried more than one, you may want to try tracking the progress and the findings, and maybe what worked and what didn't work as well. And there's also a weekly breakdown about things to help break down the navigation of the journey a little bit. We know that it can be significantly overwhelming when you've received a diagnosis, and not only are you learning all the acronyms and the language and the resources, but on top of that, you're trying to navigate this and potentially don't have your support team put together yet. And so we've broken it down week by week to help manage that process. The next slide talks about some resources that may be helpful for you. So again, this is Ontario specific. One of the key pointers that I will point out is if you are in a community and you're looking at services for autism, a key thing to put in your Google search is actually to put in autism plus services, and then make sure to add in the word directory. And there you'll be able to access, if anybody has already put together any list of service providers, that keyword can often bring up a lot that you would miss if you didn't include the word directory. But for those families that are living in Ontario, these are some really great resources. Autism Ontario has a program called the Potential Program, and through that they provide family support coordinators across all regions in Ontario. And the family support coordinator, their role is to help you with navigation and to answer any questions that you have, whether it's about resources, about the diagnosis, or gaining support. Their role is to look that up for you so that you're not doing it at all hours of the night when you have a moment of time, and resource. People for Education website, they used to have a parent hotline, but they have a whole bunch of tips and resources in a variety of different languages that help families know what their rights are in the education system. And also Mahoney Advocacy. This is a website that allows you to access consultations for specific situations that you may be going through, and also breaks down things like IEPs and special education plans for your family as well. And the Special Needs Roadmap is actually a great resource. This is an initiative put together by two moms who had sons with autism, and they found the school system so complex that they took leadership and put together what's called a Special Needs Roadmap. And it outlines all of your rights in terms of education and special education. And it helps you really break down. You can see a little bit in the visual there. You know, you start here and you start answering the questions, and it helps guide you in terms of what you need to know and where to go. And the community resource directory that I listed there for Surrey Place, that's an example again of a directory that you may be able to find if you push in the autism directories. This is a great one for the Toronto area. The next slide talks about some helpful resources, and we'll share the slides after, but the actual links I can make sure that we get out to you as well. I apologize, they're not on the actual slide, but these are websites that have really great supports for you to do either video modeling, to create some great visual supports and access some templates. You can also access websites where you can make your own personalized personalized teaching stories, customized to perhaps your child's name or the situation that you want to create that story around, and also creating social narratives as well. So if you are just getting into the world of autism, we know that these types of resources to help prepare can significantly reduce anxiety that can be associated around, for instance, transition or meeting new people or social situations. And so there's a ton of resources that have already been made that are available for you for free. The next slide is a really important slide that I always talk to families about, and it's entitled, "What does autism look like for you?" It can be overwhelming to talk about and trying to explain what autism is in general to somebody who may not be familiar, but really what may be most useful is to talk about what does autism look like for you or your child. And so these are examples that I give to families to help them explain what autism looks like for their family. So on the left there, you'll see it looks like a little resume. It is kind of like a student resume, and it's a one-page outline that talks about the person in your family that has an autism diagnosis. And this is often useful if you're going to, say, a dentist for the first time, or going to get your hair cut, or you're meeting somebody and you'd like for them to get a little bit of an understanding prior to your appointment so that they can understand how to optimize that experience. And so not only does it talk about strengths and does it talk about the individual in general, not even related to having the autism diagnosis, but then it goes a little bit specifically into what autism is, what autism looks like in that individual, and some things to consider around, say, behaviors or experiences, sensory issues, anything that you think may be useful. It's handy to have this in a one-page as opposed to handing out a 50-page document hoping that they'll have the time to read it before your child goes to that appointment. The other resource that's great is the Autism Physician Handbook. And so this is a handbook that was developed to help physicians better understand what autism is. But I often give it to families, and it's very visually based, as you'll see. And I tell them to go in and I say, circle the ones that are applicable for you or for your child. Which ones relate? And that is often a way to start a list of describing what autism is and looks like for the individual in your family. It's also really great as a tool if you haven't received a diagnosis yet or you're going into an assessment to go in with all of these areas circled that you're already noticing in your child, because it helps to start off a conversation and funnel it down into maximizing the time and the energy. Now, I'll just end off with some resources in terms of friends, families, and peers. We've talked about developing this informal support network of people around you, and sometimes it's not easy to communicate what it is that you're trying to get across. And there are some great tools that have been developed to help explain what autism is like or what the journey's been like for you that are commonly used. And so if you haven't heard of the Welcome to Holland poem or story, this is a great one that's put together from the perspective of a caregiver, where they weren't intending to go to Holland, and Holland is where they ended up, and what that's like to end up somewhere where you didn't necessarily think you were going to end up. And it helps shine light for people who may not understand what that's like. Very recently, actually, on April 10th, we were really pleased to be part of the advisory committee that helped put together a new Sesame Street character. So Julia is a new Sesame Street character with autism, and that debuted in a 10-minute clip and showed a little bit about what autism can look like, mostly meant to help educate other children. So maybe that's children in your child's classroom or peers in the community. And this is a clip that you can share. Again, it's not going to encompass everything about autism, but it is a starting point for some conversation and maybe picking out what elements that we see in Julia may mimic some of the pieces that you may see in your child. There's some other resources that I've listed there as well, such as the top 10 things a child with autism wishes you knew. And then there's also one that's great for teachers or any educational professionals, which is the top 10 things students with autism wish you knew. And it really helps break down from the perspective of the individual what life may be like and what their experiences are like, and also where there may be some challenges in other people understanding what autism can look like. And then in our 100-day toolkit, it talks about what are the four-step process for disclosing autism. How do you explain to your child that they've received a diagnosis of autism, telling others and telling peers. So I know I've gone through a lot of information today. I hope that some of this was useful for you as a starting point. And again, I do invite you to reach out to me if there's any other questions that I can support you with that are specific to your situation or more information about what I talked about today. So I thank you so much for your time, and I will pass it over to the team.
Thanks so much, Esther. That was such wonderful information. It looks like we're just about out of time, so if there were any questions sent in, we will address them and send out answers individually. We thank you all so much for your participation, and have a wonderful evening. Thank you so much. Bye.